Quick question. What's the difference between cutting jobs and cutting care? Because right now, the Department of Veterans Affairs says they're cutting up to 35,000 healthcare jobs, but promises veterans won't feel a thing. Sounds comforting, but also sounds a little suspicious. Here's what's actually happening. The VA plans to eliminate 35,000 positions, mostly from doctors, nurses, mental health staff, and support roles across VA hospitals nationwide. And before anyone says, relax, they were unfilled jobs anyway, let's talk about why they were unfilled. VA hospitals are already dealing with staff shortages, burnout, and wait times that can stretch months, especially for mental health care. So those open jobs weren't extra. They were the help that never arrived. Now transition with me for just 1 second. Earlier this year, the VA already lost nearly 30,000 employees through buyouts and attrition. On top of that, job applications to the VA have dropped sharply. Translation, fewer workers, more patients, and now fewer positions to even hire into. VA leadership says this is just cleaning up COVID-era roles and that care won't be affected. But frontline staff and unions are saying that's not how reality works, because when demand goes up and staffing goes down, something always gives. And usually it's wait times and the veterans, or quality, or most likely both. And here's the biggest picture coming out of the headlines, which they skip. At the same time that these jobs are being cut, the administration is pushing more veterans towards private healthcare outside the VA system. This could be a good thing for veterans, but we got to see. So this isn't just about jobs. It's about whether the VA stays a fully staffed public health system or becomes a referral office. Once those jobs are gone, rebuilding them is going to take years. So the question really isn't, are these positions filled? It's what kind of veterans healthcare system are we quietly building? Look, this is going to keep on unrolling. It's going to have huge impacts, not just for veterans, but also for contractors, business leaders. So make sure to like, subscribe, share this around, because if you got a great opinion about this, it's time to reach out to your congressmen, to your senators. And if you like this, you probably also want to reach out to your senators and your congressmen, because they're going to get a lot of calls coming in from veterans. Make sure to subscribe, make sure to like. If you got any questions, we try to answer every single question, every single comment below. So until then, talk to you later.